everybody, I'm Dr. Vaidyanathan. I'm a consultant gynecologist at Max Hospital, Pitampura. A fluid-filled sac which is present in the ovary of patients. Now, more often than not, these cysts do not cause any problems, they do not cause any harm, because in a majority of cases they are just physiological, in the sense that during the course of the menstrual cycle, a patient might have something called as follicular cysts or corpus luteal cysts, which disappear by the time the patient has her menses. Many a times, ovarian cysts can cause issues and problems related to menstruation itself, like in a condition called as polycystic ovarian syndrome, or PCOS as it is commonly called. What happens is that the egg production is affected in patients, because of which the entire ovary develops multiple small cysts in its wall. Because the egg is not released at the time of ovulation in these patients do not menstruate regularly. Many a times they have prolonged periods of amenorrhea, that is absent menstrual cycles. This may be associated with weight gain and difficulty in conception also. Normal process of ovulation is affected. Egg production is affected. Egg release from the ovary is affected, because of which the ovary is actually converted into a large mass of tiny little cysts, because of which the patient does not menstruate regularly. Now, since the uterus does not receive the proper impulse to menstruate, neither is the egg getting released on time, these patients tend to have lots of issues as far as conception is concerned. Also, since their cycles tend to get irregular, they also tend to put on weight, leading to a lot of other social and psychological issues in these patients. In certain conditions wherein the cyst tends to become a little large in size, especially in patients where the cyst tends to become more than 5 centimeters in size, or if the cyst is associated with a condition called as endometriosis, wherein there are lots of adhesions involved in and around the ovary, what happens is that these cysts tend to compress the normal ovarian tissue, because of which ovulation in these patients is affected primarily because of the size of the accompanying cyst, because of which there might be issues in ovulation, and again there might be issues in conception as well. Encounter a lot of patients who come to us with ovarian cysts in pregnancy, and what we do advise them is, please do not get panicky, do not get scared just because there is an ovarian cyst. It doesn't really matter much. What we do in pregnancy is we tend to monitor the size of the cyst on the basis of ultrasound. Ultrasound examinations are done every month, and we see whether the cyst is growing in size or not. If a patient has been diagnosed with an ovarian cyst in pregnancy, nothing much needs to be done. The patient just needs to go for regular follow-ups to her gynecologist, get regular ultrasounds done.